This is James Lowry with James Lowry Hypnotherapy, where I, with the help of a medical professional, aid adults suffering with immune disorders in relieving the emotional stress surrounding their discomfort in order to achieve a better quality of life in as little as one session. Today's frequently asked question is: are immune disorders genetic? Now, before I answer that question, I want to make it abundantly clear that the information I am presenting is not to serve as a substitute for medical advice. My role as a hypnotherapist is to serve as an effective adjunct to those already receiving medical treatment who might need additional care. Are immune disorders genetic? Primary immunodeficiency disorders are present at birth and are oftentimes inherited. They affect an individual's body to produce specific immune cells and or antibodies. A family with a history of autoimmune disorders carries with it a greater risk of their offspring developing similar genetic predispositions and or autoimmune disorders. The genetics themselves create a complex interplay between the predispositions and environmental triggers, such as emotional stress. Now, currently, there is no normal, absolute, or sterilizing cure for an autoimmune disorder due to the fact that it is not possible to eradicate the genetic predispositions. However, there are what are called functional cures for autoimmune disorders, meaning the disease itself is still present, but there are no active ongoing symptoms for at least 12 months, and this is not owing itself to any immunosuppressive medication. Now, functional cures of this type often rely on functional medicine, which uses holistic approaches to target the underlying causations of a particular condition present within one's physical, mental, and emotional health, rather than focusing on just the symptomatic expressions of the condition. Now, at the root of many autoimmune disorders is some type of dysregulation between one's immune system, one's nervous system, or one's neurology, or perhaps a combination of all three. Thankfully, there is a branch of science known as psychoneuroimmunology, which studies how one's neurology and one's nervous and immune systems all interact with and affect one another. At the core of psychoneuroimmunology and its applications in the form of mind body therapies, such as hypnotherapy, is looking at where one's attention is placed, the degree to which that attention is gathered and maintained, and the overall emotional quality or flavor of that attention. Mind body therapies, such as hypnotherapy, aim to therapeutically affect attention in this way so that individuals can reestablish a healthy communication between their neurology and their nervous and immune systems. Now, you might be thinking to yourself, but James, I've tried talk therapies before and it didn't work. How is this different? Well, most therapies aim to alter or bolster your conscious perception of the problem. But let me ask you something. If you could consciously decide right now not to have the discomfort you are experiencing, it would only be reasonable to assume that you would consciously decide to do so. Would you not? If you could have consciously decided not to have taken on the condition at all, again, it would only be reasonable or fair to say that you would consciously have done so already. So the discomfort and the maladaptive psycho-emotional responses that surround it do not effectively exist in the conscious mind. Rather, they are most predominant in the unconscious part of the mind. So, if you're looking to adopt this type of therapy, one that focuses on the unconscious mind in a way that allows you to relieve the emotional stress surrounding your discomfort in order to achieve a better quality of life in as little as one session, then give me a call or book a free consultation at James Lowry Hypnotherapy. I'm always happy to help.